are all informed of the mandate issued by Tony Preckwinkle and Cook County Department of Public Health that is beyond their authority and is an overreach. This mandate stated, as I'm showing here, that for all indoor settings where food and drink are served for on-premises consumption in health and fitness centers, businesses must require any individuals 5 years of age and older to show proof that they are fully vaccinated against COVID-19 with an approved vaccine in order to enter the establishment. Businesses must require patrons age 16 and older to show identification as well, with information that corresponds to the vaccine proof. Businesses may, in the interest of efficiency, allow patrons to provide the required vaccination proof prior to entry, either to the business itself or through an intermediary. Employees must be vaccinated or must weekly show proof of a negative COVID-19 test. And businesses must develop a written protocol as well, providing details for how they will enforce this order. This order also states that a law enforcement officer with proper jurisdiction, that would be Village of Orland Park Police, shall be authorized to enforce orders issued by the Cook County Department of Public Health with respect to public health measures and shall assist in enforcing such orders. Chief Mitchell, before I get into the questions about the order itself, can you please tell me if your officers have the available time to police all of our restaurants, gyms, and entertainment facilities on top of your regular duties? I think that would be about 250 different facilities.
Mr. Mayor and members of the board, I'm Chief of Police Joe Mitchell. The department is already expending a substantial amount of resources to combat another poorly researched and disastrous Cook County policy of catch and release. Law enforcement and certainly the general public have witnessed on TV, on social media, and unfortunately in person the devastating outcomes of this government overreach and the impact it's had on safety throughout the region. I simply do not have, nor would I devote crucial resources to this new ill-advised policy, an unfunded policy whereupon the Orland Park Police Department would have to assist with dealing with vaccine passport mandates. In my humble opinion, with nearly 27 years of law enforcement experience, the time and efforts of department personnel are better suited to implementing efficient and effective policies and procedures, as we currently are, that have proven track record of keeping Orland Park residents and their visitors safe.
And Chief, correct me if I'm wrong here, but this year we have the lowest crime again on record and with only 3 days left in the year.
Let's keep our fingers crossed, but yes, Mr. Mayor, we currently have the lowest amount, but that is due to the fact that we've sacrificed tremendously. We put our officers at risk. Our gun arrests are up substantially.
And violent crimes are also down again. So we're taking our time to actually keep our residents safe at significant risk to our officers and expending significant resources to keep our residents safe from actual crime. And doing this would take them away from those efforts, correct?
Certainly.
All right. Thank you, Chief. I appreciate it. It is clear that the Cook County government is not concerned with our officers' workload. This isn't surprising to me or anyone else up here, considering Kim Foxx's policies have already overworked our officers and put our residents at risk. And yet, in spite of all this, I'm shocked that they wouldn't even consider our officers when asking them to spend their time targeting law-abiding businesses at the expense of doing real police work and keeping residents safe from actual crime. None of the data that was used to make this decision was shared with the public, but supposedly it's fact-based. For this reason, I immediately sent a letter requesting that the data used to make this decision be made available. I asked for the following data that you see up here on the slide. The number of COVID-related deaths, COVID hospitalizations, and COVID-positive tests in total by date, broken down by the following 4 categories: vaccinated and previously had COVID, vaccinated and did not previously have COVID, unvaccinated and previously had COVID, and unvaccinated and did not previously have COVID, which would paint a pretty clear picture. The data being used that indicates businesses where food is served, event spaces and/or gyms and fitness centers are a significant source of COVID spread. Data that indicates that every other type of business is a less significant source of COVID spread than those that are targeted in these mitigation efforts. The data that indicates mandating proof of vaccination at these establishments will stop or significantly reduce the spread of COVID. Information that shows that employees cannot contract or spread COVID in the 7 days following a negative test. The specific law that grants Cook County the authority to mandate that businesses enforce this order. The data or information that was used to select the future data of January 3rd as the implementation date for these mitigations that would be most effective. As of this meeting, as we sit here right now, here is the data that I've received. Yeah, nothing. Received zero data. If this was truly a data-driven decision, it would have been readily available. However, not only have we received zero data, we haven't even been given the courtesy of a response saying that they received our letter. Why? I can only assume that there is no data that supports this decision, and it is political and as capricious as it appears. The first line in the order reads that businesses must, I'm reading this, businesses must require any individuals 5 years of age and older to show proof, that's 5 years of age and older, to show proof that they're fully vaccinated against COVID-19 with an approved vaccine in order to enter the establishment. It also requires vaccine proof for any non-school related athletic activities. Combine this with the fact that over 82% of the adult population and 95% of the seniors in Illinois have had at least one vaccine dose, and it becomes perfectly clear that this mandate is focused on coercing parents' medical decisions about their children. For this reason, I pulled down this data and other data related to COVID in children. As you can see, since the inception of this disease, this is since the beginning, children under 20 have had more cases than any other age group, but the impact on them has been minimal. In fact, there have been almost 4 times as many children killed by gunfire in Cook County this year alone than the number of children who have died with COVID in the last 2 years. Also, currently, the region's hospitals have 826 COVID patients. Only 12 are under the age of 18. I also looked at the mortality rate by comparing deaths with COVID to the number of cases over various time periods. The good news, as you see here, as it's shown from June to present, June of this year to present, from the beginning of this to present, and then also from the beginning to June 30th of this year, you can see the mortality rates. The good news is the mortality rate has declined for all age groups, but it's particularly notable that for our senior population, the lower mortality rate is really significant, and it does coincide with that higher senior vaccination rate. However, it should also be noted the mortality rate for children who contract COVID has dropped to less than 0.005%, which is 10 times less than their likelihood of dying via suicide and 40 times less than their likelihood of dying accidentally. On top of this, mental health crises amongst children have risen dramatically during COVID because we have made children bear the brunt of this disease, which has little impact on them. This decision is clearly driven by politics and not by data, or the data would have been shared with the public as we requested. Since the beginning of this pandemic, my position and the position of the Village of Orland Park has been to inform, educate, and help the public rather than enforce mandates. It would have been nice if the Cook County Department of Public Health had done the same. When our doctors couldn't open because they did not have appropriate PPE, Cook County could not and would not provide doctors with PPE. We stepped in and sourced masks and instituted the Mask for Medical program, allowing our Orland Park medical professionals to open and provide needed medical services. When the Cook County Department of Public Health would not provide the village with vaccine doses to get seniors and teachers vaccinated, we sourced those doses from private pharmacies and provided transportations to seniors who needed the transportation to ensure they could get the needed vaccinations. The data here on this last slide demonstrates that our approach has been correct. Informing the public, operating as normally as possible with appropriate safety modifications, and not enforcing mandates and instead informing the public and letting them make informed decision has resulted in lower case rates in Orland Park than either the state of Illinois or suburban Cook County. We have also taken these positions as an elected body, not as edicts made by any individual or by the mayor. This is the way representative government is supposed to work. Fact-based, data-driven decisions made by a legislative body. If Cook County and the state of Illinois want to make these types of decisions, they should do so via their legislative body, not by individual edicts. And they should do so with facts and data that they share with the public. And they should do so with a deliberative process.